All right, this is one of my favorite moves to work on when we have some pinchiness or some tightness in hip flexion or when we bring the knee up towards the body. So we're gonna start in a supine or on our back position. And one of the most important things about this setup is our bracing. That's gonna help level our pelvis or keep it from posteriorly tucking under or anteriorly arching back. We want to keep it as neutral as possible so that the movement that we're getting is in this hip flexion motion here. So I'm going to have the working leg is going to be bent foot flat. Eventually we can extend that and start from a straight leg position, but to begin we're going to go right here, and then we're going to have the hands on the outside of the ribs, and we're going to take what's called a bracing breath. So this is going to be an inhale, expanding laterally through our hands, meaning our ribs are going out to the side, and then posteriorly through the floor, meaning that through our middle back, we're gonna feel an increase in pressure as we take air in. And if you struggle to get this on the first couple of reps, or first couple of breaths, just take your time, do some practice, and make sure that you can get this rib cage movement when you're breathing, rather than thinking about just, for example, the belly coming up as we do an inhale and the belly coming down as we do an exhale. That's a good start for diaphragmatic breathing, but we really want to be including the whole rib cage when we're thinking about bracing and midline control. So we're going to take a breath in, exhale through our mouth, like we're blowing through a straw. We're going to feel those front abs cinch down. Now from that position, I'm going to start to bring my knee up towards my chest until I start to find that little bit of sensation, just the beginning of that pinch or tightness, and I'm going to hold. Now I'm going to take my opposite hand, place it on my knee, and then I'm going to push down into my knee so that I have to engage more strongly upwards, and I'm going to hold this position and breathe into those ribs, into the floor, and hold. About 3 to 5 breaths here. Each exhale through the mouth, and we're bringing that knee direction straight up towards the body, maybe with a little bit of incline or inward movement towards the midline as I'm bracing against this hand. One more breath here. And exhale strong. Pull that knee up into the hand and relax and bring that foot down. Okay, so working to build more strength in that hip flexion is actually going to help the joint move more accurately and decrease the pinching sensation that we have, as long as it's not an anatomical bony issue, which most of the time this is a great place to start. And if we still continue to get that pinching sensation, then we can seek out some further support. But give this a try and let me know how it goes.